February is Heart Disease Awareness Month, and every minute counts. It is the leading cause of death for women, and in most cases, it is preventable. We're joined by Dr. Diana Bittner once again this morning to talk about this. This is so important, and we're wearing red for a reason. Maybe we should start there.
We are. This is Heart Disease Awareness Month, and we really want to come out with a big splash because this is the leading cause of death in women and in men. And so here we are talking about how we can prevent it.
So Heart Month is February. Friday is National Wear Red Day, so make sure you wear red again.
We had to start the week
on Friday. But let's talk about this because in women the symptoms are so different than in men of heart disease.
They are. They're a little slower. They're a little more insidious. They're more sneaky. You know, we hear about men having crushing chest pain and elephant sitting on my chest. With women, it's sneaky. It's progressive shortness of breath with exercise. Like I used to be able to walk a mile, and now I can only walk a half a mile. I get out of wind just going to the mailbox. I had a patient who was a greeter at Meijer, and she couldn't make it to the back of the store. She had to stop and catch her breath. It's fatigue. It's like, it doesn't make sense why I'm so tired. I'm sleeping, etc. It's that just maybe jaw pain, neck pain, and then we can kind of blow it off as I stretch my neck. So again, it's sneaky.
Yeah. When we talk about heart disease, what are we talking about? Damage to one's heart, I imagine?
We're talking about the blood vessels around the heart, right? So these vessels slowly over time get clogged up with cholesterol, with plaque, and then blood can't get through to supply the muscle. And so again, with women, the vessels get stiffer, so they're not able to open to get blood through, whereas with men, they tend to form plaque in the lumen inside the tube, so it's more of a sudden blockage.
Yeah. How can we know our risks right now, since this is almost preventable in a lot of cases?
Yeah, it really is possible. So we know that in some people, they start developing heart disease as early as like 8 years old. So it really can start early, and it slowly progresses over time. And so there's some risk factors we can't change. For example, age. The longer we live, the higher the risk is. But we really can change those risk factors, like our blood sugar, our insulin resistance, our cholesterol, and it's knowing what those particles are. And then there's signs, there's markers. For example, CRP is an inflammation marker. You can get that drawn today. It's your cholesterol. And then the test that really is changing lives is called the calcium score. So the calcium score is a CAT scan of the heart that sadly insurance does not pay for screening purposes, but we order them all the time. I probably order 5 a week. It's $250 cash at the local hospitals, and it's just invaluable. If you know that you've got some calcium in the wall of your vessel, it tells you that, wow, we gotta get on this.
Yeah, sounds like it's worth the price then.
It's worth the price.
Let's talk about Jane.
So Jane was 54, and she was thin, healthy, cholesterol she knew was high, but she didn't want medicine. She kept, I'll try with diet. She had some high blood pressure, but she, again, didn't want medicine, and so she's like, I'll be fine, I'll relax more. And so she was at work in a really stressful meeting, and she started to just get this jaw pain, neck pain, achy, and then just some nausea. And she's like, I just don't feel good. I got to get through this meeting. So the meeting was very stressful. It got worse, but she just gritted her teeth and got through it, and then went to her office and Googled signs of a heart attack. And she's like, you know what, this is getting worse. I'm going to drive myself to the ER, what she should have done is call 911, because then we get action right away. She shows up at the ER, says, I think I'm having a heart attack. And because her EKG was normal, she waited in the ER waiting room for 4 hours. So here she's waiting in the ER, throwing up, but again, her EKG is normal. In a man, that wouldn't probably be true. In a woman, it could be different. So she gets back, her troponin, her blood level is over 1,000. She's clearly having a heart attack. Unfortunately, might have already lost some heart muscle because of that weight, and ended up getting treatment and did okay. But now, wow, I've got heart disease.
Oh, this is so scary to talk about. So it's good to know the signs and to know your risks. So what is your takeaway tip?
Takeaway is, if you don't want heart disease, or at least to delay it, figure it out. Get the blood tests, get the CAC, and know your options.
All right, glad to hear that information. Going into Heart Month, and of course, Wear Red Day once again coming up this Friday. Thank you, Dr. Bittner.